All right. Well, so we've been talking a lot about improving healthcare in this country and focusing on primary care, chronic conditions, innovation. And at HealthNEXT, we focus on employers as a central hub to improving population health. And employers have such a unique opportunity to influence the health of a significant number of Americans. For example, HealthNEXT not only helps and works individually with companies with strategic planning on health and well-being on a one-on-one basis, but also we institute health and well-being learning collaboratives where we work with multiple companies within a community to try to influence the health of that population. And one such was one that we worked in Philadelphia. James and his company Aramark participated in that with 6 other companies. And really, and that also was supported by the CDC Foundation with the premise of really making an impact through employers with a defined population. So we'd like to spend the next 45 minutes to explore what Lisa, Tonya, and James are working on to influence the health and well-being of their specific employer populations. And I just wanted to point out, you may notice that there's a different name on the agenda. One of our original panelists was delayed and wasn't able to make it because of a transportation situation with the train. So I want to thank Lisa Leslie for joining us. She was here to accept the award yesterday for the chronic care transformation and stepped up to volunteer on the panel. So thank you very much. Okay. And so we're going to start with you, Lisa, and then we'll turn it over to Tonya Walker and James Startare to give a bio of yourself and then a little bit of introduction in terms of what are you working on right now with your company that's most pressing.
Okay.
Thanks.
Well, thank you for asking me to join. I'm Lisa Leslie, work with Hydrogear. We're in manufacturing. I've been there about 7.5 years almost, mainly just in the benefit space. Right now we're working on open enrollment, to be honest with you. And overall just educating employees and helping them understand the healthcare system and the benefit system and kind of connecting those in the places that they need help with.
Awesome. Thanks. Good afternoon. Thank you for hanging in there with us. Last panel or last session, really. So good to see you all. I'm Tonya Walker. I'm currently the principal consultant of Allegiant Patient Solutions. But most recently, I served as the chief medical officer for Netflix for about 5 years. And prior to that, I was the North American regional medical director for Unilever. And so a lot of what I'll be talking about today will draw from those 2 experiences. I'm an ER doctor clinically, but also an occupational health and a preventive medicine and public health doctor as well. And I think as we continue this discussion, one of the programs I'll be highlighting really will be around mental health in the Netflix population.
Great, thank you. Good afternoon, everyone. So I'm James. I mentioned earlier I work for Aramark, a global food service organization. So we're pretty complex. We have about 140,000 domestic employees, about 260,000 internationally. We operate in every state. We operate 10 different lines of business, and those lines of business are very different. I'm sure if you've all eaten our food at some point in time at stadiums, at colleges, hopefully not at correctional facilities, for sure. But we are complex, so we're running like 10 different companies within one organization. So I've been at Aramark for 6 years. I am from Philadelphia. I have a deep background, 25 years previously at Independence Blue Cross, Aon Consulting. I led the benefits for the city of Philadelphia under a prior mayor administration. So what I love about Aramark, again, as I mentioned already, is the complexity. Now, we as benefit leaders wear many hats, for sure, as fiduciaries, as plan sponsors, as operators, as administrators. So we're doing a lot of different things at Aramark, like so many employers, to really just try to mitigate our trends, stay ahead of the curve, any way we can. Some things I will talk about today specifically is how we have direct contracted. You heard direct contracting come up a little bit. It's not a new term, it's not a new philosophy, but it's something that we at Aramark have leaned in pretty heavily. And I'll explain a little bit of why we think it's unique for us and how it has grown for us over the past couple of years.
Thanks, James. So, as we know, based on where your employees are, what type of work that they do, there's a lot of things that are different for different employee populations. So can you talk a little bit about what makes your employee population unique that's caused you to innovate?
Start. So we are in 4 states, Illinois, Tennessee, Kentucky, and Indiana. About 85% of our workforce is a blue-collar workforce, and we're all in rural areas. It's about 2 hours at least to the nearest academic hospital. So we really rely on those local hospital systems, and sometimes that works and sometimes it doesn't.
I'll mention that the Netflix culture is known to be a very high-performing culture. In fact, we have a culture deck that is publicly accessible that has changed over the years that talks about, in one phrase, I think it encapsulates it all. It says, a B-level performance gets an A-level severance package. And so that should tell you all you really need to know, right? And so by virtue of that, too, it creates this environment in which it attracts a certain type of person, right? So most people who are looking for a role, if they see that, some would say, maybe that's not the right environment for me to perform at my best, and others are like, yeah, let's go. And when you have an environment where everyone's like, yeah, let's go, you create a very tough place to work for our long term. I will tell you that the average tenure for an employee at Netflix is 23 months, both voluntary and involuntary terminations. I'll tell you that when we were looking at our mental health claims, they were through the roof. And despite that, people still complain about not having the right amount of access to care. I watched the organization grow from about 10,000 people globally, about 7,000 of those sitting in the US, mostly in California and the Los Angeles area, to 16,000 globally, where a lot of that growth happened outside the US, but still a significant amount within this country, and then become a bit more geo-dispersed. So again, most people in the US were in California, LA, around the San Francisco area, but I live in New York. And so you could see that they were looking to hire more people around the country, and we had to be able to provide services to the population outside of LA. When I first walked in, everything was very LA-centric. Well, we have benefits and our employees can go to Cedars-Sinai, and it's, well, what about all of the employees that you've now hired in Atlanta, right? What about the employees that are in Florida? Have we considered that? And so we actually worked with a vendor partner around mental health support because of the culture. We were seeing astronomical amounts of burnout, astronomical amounts of short-term disability for mental health leave. And during these last 2 days together, we've heard a lot about data. Netflix is great with data when it comes to their platform, okay? You can go and you can search for whatever you want to see. There's so much to watch, you can't watch it all. But from an employee perspective, there was nothing. And so it was very hard to sit here now and tell you, well, our short-term disability around mental health was, 10%. We had no idea. And so we were able to, by virtue of anecdotes and the employees really voicing the fact that they needed this additional support, partnering with the vendor so that our turnover rates went from 22%, that was documented. I think it was a lot higher than that, frankly, but again, the data wasn't the best, down to 11%. We had initially, when we first rolled out this vendor partner, 16% of our employee population enrolled for mental health support virtually. And up till today, it's now at 32%. That's higher than Book of Business, which is at 16. And in the industry, in the tech industry, more specifically, it's about 15%. So we're doubling the utilization of those healthcare services. But I'll tell you, our ratings for the services, 4.6 out of 5. 93% of the employees who are seeking care are matching with their mental health provider, and sticking with that first provider because we wanted to be sure the vendor could provide a diverse provider network. And so it's working really, really well. I think a lot of what we've talked about also today and yesterday was around culture, eating strategy for breakfast, right? And so the Netflix culture that I talked about with that one-liner was something that we really had to start working on so that we can provide an environment where people could stay for longer than 23 months, right? Because you're bringing the best of the best in-house. You don't want to just leave them kind of burnt out on the side of the road. So some successes there.
Yeah, so Ivor, I think the question was about complexity in our organization.
Yep.
So I mentioned already that Aramark has 140,000 employees across 10 different lines of business. You know, of that population, 85% are hourly employees. So that's lower wage employees that earn anywhere between $12 to $15 an hour. We also have employees that embody the client for which we serve. We're very unique. Like, for example, people that serve the food here, they could be Aramark employees, and we may not even know it. If you went to a Commanders football game, the people serving your food, if you asked them, who do you work for, I would say 8 out of 10 people would say they work for the Commanders. They don't work for Aramark. So that's a challenge that we have, but we also see it as an opportunity. The other pretty interesting challenge is we have about 530 labor unions that we work with. Okay? So when you take a step back, it's like, oh my Lord, all right, how do you even get out of your own way to function? And what are the two top labor concerns, right? Salary and benefits. So it's an interesting dynamic because when we manage benefits, you know, every employer is certainly unique, but when we manage benefits, we manage them for our non-union population and our union population. And I would say about 40% of that union population opt out of their health and welfare benefits into our Aramark benefits. So it's almost like this internal, I don't want to say struggle, but we want to keep our benefit costs down and to see if it's financially beneficial for them to be on unit benefits where we're paying a PEPM to the health fund, or to bring them over to Aramark benefits. So that part's interesting. The opportunity that I mentioned a moment ago is because within those lines of business, we serve food at health systems, whether it's cafeterias or patient food. We partner with some of the largest, most high quality and reputable health systems in the world. So my idea and concept is, why don't we take advantage of this, right? We are vendor partners. Let's find a way to partner together and leverage that partnership, not as a B2B contract, but as a relationship where we're either serving your food and have an existing engagement to see where the opportunity exists. So what I've been doing is going to large health systems, one that provide the highest quality in large metro markets where we have a critical mass, where we think we can have a meaningful impact. And I'm simply saying to the health system, would you be interested to have a conversation? Not do you want a direct contract, not this is how we want to do it. Would you be interested to talk? And I would tell you, almost everyone says yes. That we all know the state of hospital margins. If you could say, hey, we are a commercial payer that's willing to give you more patients, generally they're going to say, let's pull up a chair and let's have a conversation. You know, I can unpack that more. I'm sure we'll get into some of that. But again, it's kind of pulling you out of that complexity and the challenges that we have and trying to see where the opportunity exists within them.
Yeah, thank you. I think that everyone is interested in understanding how employers work within the ecosystem of healthcare. Lisa, I wanted to ask you, just to kind of reflect a little on what Tonya was saying around EAP and maybe even into telemedicine, because I know when you talk about rural populations, access to care is sometimes a challenge, and how you address that.
Very challenging. You know, if you want to find somebody that's a mental health provider, usually 50% of the time they're not in your network, so then you have to find somebody else. And just getting in to see that person, they may be, you know, a month or two out. It's almost as hard as getting into your PCP. So we moved to like more of a virtual telehealth vendor, even preferring that over our EAP, where the EAP, you have somebody that is having suicidal ideations and it takes 3 to 5 days to get an appointment for them. This telehealth vendor is on the spot. As soon as you call them, they get a mental health professional in contact with that person at that moment in time. And it really, really helps build that relationship with them, number one, and keep them coming back and helping that mental health situation ongoing.
Excellent. Yeah, and I know you've gotten great feedback from
Yes.
employees that have been able to have a resource that they didn't have
Correct.
before.
Correct, and at any time of the day or night, too. So that's the other piece of it. I think 55% of all their calls come in after hours. So that's a big piece of it, too, is giving them that access.
Excellent. Are there, curious, James, kind of building off of your conversation around integrating with healthcare ecosystem, and really, you know, I think it would be helpful to go into a little bit more detail, and then also for Tonya, you and Lisa, what are other ways that you've worked with integrating and connecting with the healthcare ecosystem and hospital systems?
Yeah, I'll start. Yeah. For the record, too, I mentioned the Commanders earlier. I'm from Philadelphia, and so my heart is breaking because I even said that a few minutes ago, a little bit. So go Birds, right? You got to get, you know, that's just how I'm wired. You know, with that said, and the question is I said complexity about 15 times already, and I'll say it again because, Tonya, you said it earlier, like if you're in Atlanta, it doesn't work for someone maybe in Tennessee or so what we're doing is we're building another medical plan option in key geographies. So if you look at the Dallas market, Baylor Scott and White, the largest health system in northern Texas, who happens to be a client of ours, you know, we have a Baylor Scott and White premier medical option. Well, how did that come to be? Well, you know, why should the employees, the Aramark employees in that health system, not get similar benefits as the employees of that health system for the reasons I said earlier? And it's pretty simple. When you look at a health system model, a 3-tier structure with a domestic claim channel, that's all we're essentially doing is we're creating a medical design that looks like a hospital system. We're offering that plan to every employee, not only in that health system, but every Aramark employee within that North Texas geography. You know, so it's thousands of employees that now have a new medical option. That new medical option has a $0 deductible, a very rich benefit design. So now we're a food service company that competes with hospitality and retail space that's offering benefits comparable to a health system, right, which is unheard of, which is very, you know, which helps our retention and our recruitment efforts. And on top of that, then now, and this is where my job is completely taking a shift. Now I'm negotiating a contract for a reimbursement level that I'm saying, well, how do you go about doing this, right? I pride myself definitely not being the smartest man in the room, but I know what we're paying, or have a good sense of what we're paying the bukas, and essentially we're saying, we need to pay you less. We need to make enough money to cover this medical design, to cover the contributions, and save a little bit of money. Where I have seen direct contracting go in a little bit of a different direction, are people saying, well, it's a lot of work for a little reward. And I'm not going to disagree with that. It is a heck of a lot of work. But the reward is now, again, we're giving thousands of employees a medical design, as I just mentioned, that's extremely rich and attractive, that we're negotiating a rate that's X% better than commercial, and that could look different in each health system, whether it's a custom fee schedule, whether it's a flat percent, or whatever it may be. And then we're getting a better price point, which is advantageous for us. Our employees are getting a richer benefit design that stacked compared to the other plans is much more attractive. And then, again, the health system is getting patient steerage. But the most important thing is the health system which they're going to. You know, now we all know in a health system could be, you know, get a great leapfrog score, get a great CMS rating, but within a health system, not every physician is going to be perfect. We just know that's not how it works. So there's a lot of models out there, right? A lot of companies, there's the Carums of the world, the Lanterns of the world, that offer these kind of direct contract models. We're taking a kind of similar approach, but we're wrapping around the health system. We're saying we believe in this health system, and the more employees that go to this health system over time, the outcomes will be better. So what we're doing, not year 1, but year 2 or year 3, we're building quality metrics and some relatively simple performance metrics to make sure that we're getting the clinical outcomes that we're striving, such as better colonoscopy ratings, better mammography ratings, lower ER visits, relatively simple metrics to start.
Excellent.
I'm happy to jump in. So again, just thinking about the mental health journey that Netflix has been on, and its connection to the health system. So we use this particular vendor. Can I say the name? I don't think I can say the name. Yeah? Okay. So we transitioned from a more traditional EAP to Lyra Health. And traditionally, as you all know, when you have an EAP vendor, oftentimes as an employer, you offer a certain number of visits, right? So 6 sessions, and maybe it's per year, maybe it's 6 sessions per issue per year, however you design it. And what we decided to do is just kind of like throw that out and say, okay, what we're going to do is offer 25 sessions, 25, out the gate for a year per member, right? So employee independents who decide to sign up, great feedback for that, but then quickly realized that because of the need, people were meeting that 25 session point, and then what happens after that. And so this is where the integration came in. So we didn't want employees or their dependents to kind of be left out in the cold. And what we've done is connected then that same provider into the health plan. So they were able to transition their care seamlessly. The employee half the time didn't even know that was happening in the background, so that the health plan would then pick up the costs of that ongoing care. And we found that 8% of the employees who are enrolled in the Lyra benefit actually do hit that 25 plus mark. And out of the 8% who hit that, 25% actually do really, really well. And we've gotten an 82% satisfaction rating with that. So that was our way of kind of integrating a bit more with the health plan. It seems like, at least according to our health plan, that we were the first to ask for something like that. And so again, there was a lot of work on the back end, but the rewards were, too numerous to count, quite frankly.
And that's expensive.
Yeah.
Coming from a large, publicly traded organization where everything is bottom line driven, and we've looked at Lyra and we looked at some organizations like Lyra, and we have high interest, but that is kudos to Netflix for doing that.
Yeah, no, great point. Extraordinarily expensive, but Netflix was paying a lot more for turnover, right? So each time they were going out and having to replace an employee, you're looking at 80 to 90K per head, right? So here, and because again, trying to recruit from the Googles, from the Facebooks of the world, and already at baseline, these are high earners in the tech industry. I'm talking mostly about the Netflix knowledge workers, not on the production side. That's a whole nother issue with unions, et cetera, right? So super expensive to recruit and try to retain this top talent who are performing at that A level. And so from our perspective, it was like, listen, just pay it, right? And at the end of the day, we've been with them about 3.5 years now and have already saved 1.5 mil. So yes, paying a lot up front in order to cover all of the sessions with providers from all different parts of the country, all different backgrounds, coaching, therapy, virtual, in-person, employee, dependent, all of the realms. But at the end of the day, it saved a lot of money. And we, in fact, were able to gain some savings from it as well.
Yeah, and we definitely know that there's 2 to 3 times savings in productivity by
Correct.
More than just healthcare costs alone. So all of these efforts are even multiplied further.
Yeah, and I would also say that, sure, dollars and cents, we had some savings, but also we've saved on inpatient behavioral health admissions and ED visits, right? And as an ER doc, I am always up for keeping people out of the ER who don't need to be there, right? So, living the dream here.
Absolutely. So I want to shift a little bit now. We've talked a lot about how to manage care for the people that are kind of more on the acute and chronic side of the population health continuum. But what are some examples of things that you're doing or have done in terms of keeping the well, and really focusing on keeping your population as healthy as possible and avoiding them entry into the healthcare system when possible?
So we started our journey about 2018. In 2019, we introduced a whole new health plan, integrated a lot of different programs, And the problem is that people don't remember all of those programs. So then we implemented an advocate through my PHA. It's one person that knows our plan by heart. We bring him on site once a year to kind of build that relationship with employees. He can talk with any employee, with their spouse, their dependents, and kind of listen to them, help them understand what the doctor told them in their visit, help them find out what the next step of their care plan is. Oh, you need, a joint replacement. How about we go and do this as a second opinion? We have a program through Mayo Clinic for complex care, especially for, complex diagnoses, second opinions on cancer, difficult diseases like that. And he's the one that helps them apply for those programs. So that's been a really great help for us, especially since, I mentioned, we have just the hospital systems in the rural America. There's no independent PCPs that we can kind of contract with. So we're really depending on him to kind of help not only steer them in our plan, but also help them advocate for themselves at the doctor's office and not just sit there and nod their head and say, okay, during that PCP visit, but actually ask questions.
Mm-hmm. And I know you spend a lot of time promoting
Yes.
primary care and also
Prevention.
prevention and also biometric screenings and a lot of communication efforts.
Yes.
Maybe you could talk a little bit about what you do on the communication side, because I think that that's really important as we talk, how do people get information these days? And especially when you have desk workers and then non-desk workers, and how are we communicating people, it's the TikTok world, and everyone wants short snippets of information. That's all they can take these days, and so you can't expect them to read long things. But what are some of the things that you've been doing?
We tried the original things, sending out an email, then sending it with bookmarks so they could jump directly to where they needed to go. Slides in our start a shift meeting for our production workers, and then we just happened to stumble on. We started doing videos, and then I had one video where I was throwing things, and everybody loved me throwing things. Well, I can do that all the time. So I think now people kind of watch them to see just how much crazier my videos will get, but they're usually like 2 to 3 minutes. And just kind of putting it in a manner that they'll understand what I'm talking about. From anything from getting your annual exam to getting biometrics to why you should get a colonoscopy and not a Cologuard test. For financial reasons. A lot of them have financial issues, so we also promote the financial program and those communications too. There's not any part of the benefit program that I don't communicate and throw something or have benefits Barbie standing next to me.
And Tonya and James, anything you would add on keeping the well and other programs that you have in place?
Yeah, thank you. And I love Benefits Barbie. That's awesome. So keeping the well, again, I'll come back to culture because the Netflix culture is really something else. And I watched it kind of very slowly shift because the population has slowly shifted. So I talked about the growth in terms of the number of employees, but we've actually now had about 50% of the employees are women now. The average age has gone up. So when I started, the average age of employee was 31. And when I left, it was 36, right? So those are meaningful years, and the things that you are concerned about and addressing in terms of family forming, reproductive health, access to care, holistic care, GI, all of the things, we had to kind of think through a bit differently. And so in terms of keeping the well in a culture that some would say is designed not to do that, right, is really working with leadership, working with HRBPs, helping to train managers, because again, a lot of what we talk about in this room that seems very second nature was like totally new in the Netflix realm. So really leveraging the ERGs and doing education sessions as a part of the employee health team. And oftentimes they would tell you what they needed if you would just listen to them. And so that we've thought was really, really quite effective in keeping the well. And then also maybe we need a benefits Barbie to help steer people toward the benefits we have. Because again, it's the same story. We have fantastic benefits, but no one knows about them. So spending a lot of money on great things that can help with prevention, with treatment, care management, survivorship, all of the things. And then when no one knows about them, they're not effective.
I wonder if Netflix could make videos.
I wonder.
Probably, maybe.
No,
You should suggest that.
Literally, I've pitched that so many times. Like, can we leverage some of the tech that we have for the employees? I know it's for Netflix members, but like, can we get like an eighth of it just to, help our employees out?
I know a guy, right? So pulling from some of those themes, I mean, what I'll say is easy and affordable. I mean, it's obvious, when we're talking about, food is health, same thing, right? Make it easy for people. Same thing with benefits. And I'll start with the affordable part. How many in this room have heard of early earned wage access? Right, so a few people have, right? One person has, right? Yeah, a few people. Yeah, so when we implemented this about 3 years ago, I was blown away, right? It's a simple concept of paying employees earlier, but it was easy. So after 1 month of implementation, we had 45% engagement. Right? Think about that. Think about a benefit program. If we were, and so it took me, 2 years of fighting, saying this is not a benefit. This is a payroll function, to me end up owning it and it being one of the best things I've owned, because, and sadly that it's needed, but I'll start there by saying it was highly utilized. Now again, sad that there's a need for it, but we're able, with the proper guardrails, to get money in people's hands quicker, right? That led to literally, after that first month, it's like, oh my goodness, we need a true financial wellness program, right? I mean, we kind of knew it, but when you see numbers like that, and you see the testimonials of why people need money early, it's pretty heart-wrenching. So again, but it's easy. It's a simple app that looks like an ATM in your hand. So easy and affordable. Then we implemented a financial wellness partner, right, that tied directly into the early wage program. So when people need money, why do you need money? Talk to a counselor. Most financial wellness and wealth coaches are for the top 1 or 2%, not the rank and file employees. So speaking of expensive, this is costing us quite a bit of money to implement this financial wellness, but we have phenomenal enrollment and engagement because of that direct tie-in. And I can say the same thing even with our medical design, back to the direct contracting. I mentioned no deductible, low out-of-pocket cost. Now, I'm a big proponent of high deductible plans. I think we all would say that when used wisely with your HSA. So of my enrolled population, 48% are on our high deductible plan. We offer one high deductible plan. Of that 48%, 15% are contributing to their HSA, right? So it's immediately telling us that in that population, and I don't have data to support this, that population who I mentioned make $12 to $15 an hour are building up some kind of healthcare debt. So we talk about student loan debt, we talk about credit card debt, healthcare debt is real, which kind of goes full circle of why we're doing direct contracting and is the juice worth the squeeze? Well, it is when your employees are struggling to get by and you're giving them a local healthcare option and a high quality health system with low copays and zero deductible. So I say all that, again, back to affordability, right, and making it easy for employees. So two kind of very different topics, but me and my team and I, we don't kind of make a move without thinking about affordability and easy for the reasons I mentioned.
Excellent. Well, I want to leave a little bit of time for any questions, so think of any questions you have, but also, I think it was mentioned a couple times, leadership. I want to talk about leadership in your organizations, and what types of things have you done and your team's done to influence leaders, and I guess I'll expand that to leaders and managers so that they then can lead by example and influence others.
Happy to jump in here. Okay, so again, the Netflix culture. So our top leadership, C-suite leaders, vice presidents, mostly C-suite, they're like, Walker, go ahead, do your thing, figure this out, right? The vice presidents, there are a few who were allies, I would say. You need anything from us, let us know, type of thing. But we found that really it was the managers, right? Implementing manager training to help them understand the significance of rest for themselves and for their employees. Something as simple as rest was like a foreign concept because, again, very high-performing culture, go, 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 right? If you send an email, literally the culture is if you don't respond within 5 minutes, what's wrong? We're thinking about performance management, this type of thing. And so being able to roll out a training program to managers, piloted where majority of the population is in this country, in California, in the LA office, to help them understand that really people should be working from rest, not trying to rest after working themselves to nothingness. And we found that the feedback for the sessions were super positive, and that employees who had managers who had actually gone through the training were employees who stayed longer, had higher satisfaction at work. And one of the issues that we saw come up quite often with the Lyra provider were relationship issues. So one of our top 3 issues that people are going to get mental health services for, the third is relationship issues at home. And we found that, as data has shown, your manager sometimes is more important to your mental health than your partner, right? And so by virtue of people having a manager who understood, like, that I'm not a machine, that I will perform better if I have something called sleep, or just, take a break between the back-to-back meetings in a 16-hour day, it really made a lot of a difference. And those teams became high-performing teams, right? So the relationship between the manager and employee got better, the relationship with the employee and their family got better, but the team dynamic improved. And they were able to push the business forward, right? So really, again, not easy to do, but the juice certainly worth the squeeze.
I could just say I am lucky in that respect. So, I have a manager that supports me, and our CEO also. We meet with our broker once a year and have a all-day strategy session on what's going on, what can we change for next year. And we're a family company. The CEO's been there, I think, since day one. So we kind of know our people, right? There's 30 couples that both the spouses work for HydroGear. That's not counting all the sons and daughters and parents and cousins and everything else that works there. So we kind of understand what's going on in the communities that we're at. And we just, I don't know where I was going with that, but yeah, I'm just so lucky I'm speechless. Yes, yeah, the support is great. I mean, how many, managers do you know that'll let you throw things on video and play with dolls during the daytime, so.
Yeah. And I think you even get higher leadership to do videos as well, right? And communications as well, which is important.
Yes, we have done that. Mm-hmm. When we get a testimonial, I always ask them, do you want to do a serious one or a fun one? And occasionally I get one that's fun, and so we just have a good time.
Yeah. And it's amazing because doing a quick video like that even with managers, I know you've done managers trying to encourage employees to go to screenings and that sort of thing. So it's not hard to do that, but why don't we do it? And I think you do it, make the effort and do it, and it reaps benefits.
Right, definitely.
James, you want to close us out, and then we'll have a couple questions?
Yeah, sure. So I've been beating this drum for the last half hour, so I'll keep beating it on these direct contracts. So when I go to my leadership and say, hey, we have an opportunity for a large health system client to be even stickier with that health system, they love it, right? They love it. Or an opportunity to say, hey, I have interest in ABC health system to partner with. We don't do their food. But, we could lead a sales proposal on food and facilities with health benefits. So when you can say, total rewards or benefits now becomes part of the revenue generating cycle of an organization, it's pretty cool, right? So that part I love, right? Playing back from my consulting days and sales days, I'm so amped about that. That's pretty cool and exciting. And in my time, right, and this is probably the least novel statement of the day, but when you have credibility, right, and say, you saved this much, you've done this much, it really makes the other decisions kind of fall in the line. No, I don't walk out of a meeting with a yes on everything, but it does really help and kind of lowers the temperature of what, at least the amount of rope my C-suite gives me, which fortunately, knock on wood, is quite a bit. But to your other point, change management is a real thing, and it's hard. And it's turning like a cruise liner around in a pond. And it's really hard, especially for organizations as large as some of the ones in this room or some of your clients. So it needs to be, like communications needs to be, and I've learned this over time, and I'm really not that great at it, to admit, is to really take a step back and say, well, we want to do this, but are you building enough time? Are you really building the right communication? As I like to think as a strategist sometimes, I'm thinking big picture, so I kind of try to surround myself with people that can help me really make the change, because if it's not implemented effectively, with the frontline managers and the HR directors and HR VPs at locations, then it's all for naught. And also, I said a few minutes ago, make it easy and affordable. When you have, at least, from my experience, when I think of a line of business in my organization and a region, and when I talk to the heads of that line of business or the heads of that region, when they hear how it affects them, whether it's a behavioral health program, it's like, oh, my child could really benefit from this. Or if it's a medical design, it says, oh, wow, I'm gonna save real money. Me, as a VP or an executive, right? We're all not immune from saving money, right? I can save money, and once they're bought into it, it really does help cascade it down.
Absolutely. Thank you. Definitely shows the complexity of the demographics, the psychographics, and just the situations that each employer has. So we have a couple minutes, I think 2 minutes. Any questions for the panel? Laurel.
How are you administering the direct contracts? I'm guessing it might not be a PHA, but a TPA?
Actually, it is. So the first year we introduced this in the Dallas-Fort Worth market, I used a freestanding TPA, and then my tier 2 level of benefits was reference-based pricing, and that was intentionally designed that way. The following year, which was 2025, and going into 2026, I'm using Meritain as the TPA. So I am using, and the reason behind that, and it doesn't work perfectly or fit in this nice box, but I don't have to, quote unquote, purchase a wrap network, and I prefer to use a network than RVP for tier 2. Yeah.
I think we have another question.
Oh, sorry, I totally lost my train of thought. So the CDC got rid of their worksite wellness program this year, and like a few other states, Maryland used that as basically our template to evaluate our Healthiest Maryland Businesses program. So we're in the process of trying to figure out, state specifically at least, like how do we award these very business specific focus areas in our state as them being considered to be healthy leaders in the business. And I'm just trying to figure out, I guess, like outside of, the main topic areas that everyone focuses on, like cancer, breastfeeding, stuff that goes along with your everyday resources. What are kind of priority areas you're thinking might be upcoming in the future that we should kind of look to add? I know, obviously mental health is a huge focus, and it's definitely stuff that we've been promoting, but outside of, the ones we all see kind of currently, like, do you guys see anything on the horizon that we should be starting to think about as essential to how we monitor the businesses in the state?
I mean, I've seen inflammatory diseases is really increasing, along with the mental health, and cancer, of course. We always try to convince people to get their preventive screenings to kind of catch that stuff earlier as opposed to later. But I would say inflammatory is probably another one on the horizon.
Yeah, I would say in the mental health space, but we have seen our mental health claims creep up year over year for the last several years. But in that space, substance abuse.
Mm.
You know, so substance abuse specifically, I've seen spike up. And the thing with substance abuse is the network access. And so, you know, things that we've looked at is the reimbursement models. You know, if out-of-network reimbursement, which should be used for out-of-network reimbursement. If you want to use a different reimbursement, it should be, you know, Medicare related or whatnot. So an opportunity there as well, for sure. GI as well. I mean, not as high dollar, but a lot of prevalence.
This one may be a bit outside the box, but what I would love for people to begin considering a bit more is the impact of the environment on health. I think your commentary around inflammatory diseases, autoimmune diseases, if you really start to dig deep into some of the cases I've seen and been involved with, or even again on larger scale population health data sets, if you look at the environment in which a person spends most of their time, there may not be a direct causal relationship, but there may be an association. And as you know, I like to think this room understands that climate change is relatively real. You know, I can tell you that you know, there are people who've never had asthma before, shown up in the ED with like severe asthma exacerbations. Okay, so and the meds are not working quite as well, and I can talk about it more for those who are interested. But for as an employer, thinking about where you're sending your people, if you are sending people anywhere, even within the four walls of, if it's a manufacturing site, a research lab, whatever it might be, trying to be sure that just think about it, right? What are the potential exposures that people may be facing? And are there maybe health impacts that, if not short term, could they potentially be long term? And because if you at least think about it, then you could potentially mitigate anything that may come up.
Yeah, and we often add in the word safety when we say culture of health, safety, and well-being, because the traditional areas where you think about safety is manufacturing and that sort of thing, but that's a really great point, is we should always be thinking about it because there's such a strong connection between safety and health and performance in the workplace. Well, I want to thank all of you for spending the 45 minutes with us. A great discussion, and I hope everyone got a lot out of it. And thank you all for coming. Rose, I think you're coming up now to close us out.